Bismillahirrahmanirrahim. Today we are starting another series of quiz with blood clotting. These are very common conditions: pulmonary embolism, deep vein thrombosis. It's a formation of clot within circulation and which causes different problems. So again, I'm starting with a quiz, display a question in front of you, and then want you to answer, and then we'll discuss few things about it. But since it's just a hint towards the subject, and I want you to cover these things comprehensively by yourself later on. Now let's start with the question. Which of the following is most commonly a physical sign for pulmonary embolism? So these are the various options: anhidrosis, tachypnea, diminishes second heart sound, and bradycardia. These are the common signs, but which is the commonest along with pulmonary embolism? These are the answer. These are very simple question, but there is a point behind this question to tell you about that how to approach. So this is the right answer, tachypnea. Remember that tachypnea is a very non-specific sign. Just fast respiratory rate. That means you have to assess your patient very comprehensively when you see a patient with tachypnea. And most of the time, pulmonary embolism is suspected. When your patient is tachypnic, he's desaturating, you're getting signs of an organic illness without clear clue towards diagnosis. That's very important. That this is a disease of exclusion. Let's go through few important points about pulmonary embolism. The challenges which we have to face is dealing pulmonary patient rarely display with the classical presentation. And what are those classical presentation? Abrupt onset pleuritic chest pain, shortness of breath, and hypoxia. The classical feature which you used to learn in academics. Patients who die unexpectedly from pulmonary embolism often describe nagging symptoms for weeks before death. And people usually miss those symptoms which are non-specific. So you have to pick pulmonary embolism on the basis of suspicion, on the basis of excluding other organic illnesses. And today we are just concerned with science and picking the basic concepts about pulmonary embolism or suspecting pulmonary embolism. Let's cover a few things. The few of indicators in the history when you are assessing. Let's see. You see travel for 4 more past months, surgery within last 3 months, malignancy, current or past history of thrombophlebitis, trauma to the lower extremity and pelvis, smoking. These are the features: central venous instrumentation, stroke, paralysis, prior pulmonary embolism, heart failure, chronic obstructive pulmonary disease. So that means this tachypnea on a background of these things and without any clear-cut organic sign, clear-cut signs of any other organic disease for those symptoms, think of pulmonary embolism. Very important. And common physical sign, let's recap: tachypnea, rales, second heart sound accentuation, tachycardia, fever, diaphoresis, S3, S4, gallop, clinical signs and symptoms suggestive of thrombophlebitis, lower extremity edema, cardiac murmur, cyanosis. So overall, in this quiz, what we have covered few important things about pulmonary embolism, and those are that always think of pulmonary embolism when you're getting features of tachypnea in a patient who's tachycardic. I have described various other signs. If you've got those combination, few signs, without any clear-cut evidence of any other organic illness, think of pulmonary embolism. Thank you very much for your patience.